Good afternoon, everyone. Welcome to the DigitalHealth.London Accelerator 101 webinar. My name is Jenny Thomas, and I'm the Programme Director for DigitalHealth.London. And I set up the Accelerator programme in 2016. So it's great to have you on the call with us today. This webinar will help you learn more about our Accelerator programme and, most importantly, whether it's right for you and your company. We've got a great agenda planned over the next hour, 45 minutes, with a range of speakers, including current company on the Accelerator, an alumni company, and some team members as well. There'll be, of course, lots of opportunities for you to ask any questions that you might have at the end. And if you want to pop questions in the chat as we go along, you're very welcome to do that. So the DigitalHealth.London Accelerator programme supports some of the best and highest potential digital innovations that can transform and support health and care. We're now in our 6th year and remain sector leading and highly competitive. Just to give you a sense of what that means in practice, last year we received 14 applications for every place. And I think Oxbridge received about 7. So it is highly competitive. We're immensely proud of the impact and transformation that many of our companies and health and care organisations we've worked with over the past 5 years have achieved. To date, the Accelerator, which is one of the programmes at DigitalHealth.London, has supported over 120 companies, with hundreds of additional contracts signed by those companies during Accelerator support. What companies tell us over the years is we're responsible for roughly 30% of their growth. So that varies, but that's the average. And also over 60% of their investment raised. It's not something that we directly do as part of the programme, but as being on the Accelerator and the connections that we give, that is one of the things that companies do benefit from. So many of the digital products and services who have provided vital innovation, support and capacity to the NHS during the response to COVID-19 have come through the Accelerator programme, whether that's enabling remote GP appointments, transforming NHS temporary staffing and patient-facing self-management apps. The Accelerator has supported some of the best digital health innovations now being widely used, and we're very proud of that. As the health and care system continues to be under pressure, as I'm sure you're all aware, and begins to recover from the pandemic, the need for innovations to solve these challenges that our healthcare system will inevitably continue to face remains absolutely vital. So let me tell you a bit more information about the Accelerator programme. So we support up to 20 SMEs over a 12-month period, giving bespoke support and advice, a programme of expert-led events, workshops, and we broker meaningful connections between SMEs and health and care organisations that face specific challenges. Each company is assigned an NHS Navigator. That's an experienced clinician or manager from within the NHS who acts as a relationship manager to the SME over a 12-month period. And it's the Navigator that provides bespoke support. Our pretty much weekly events are open to the whole cohort, and we do our best to co-develop these with our companies at the beginning of the programme and as we go on to ensure that they are useful and meaningful. The companies that are successful in getting onto the Accelerator programme are chosen through a rigorous and highly competitive selection process, as I've said, involving hundreds of expert NHS and industry panel individuals through interviews and application and further due diligence checks. We're really open about what we look for. We always have been. We look for 3 things. We look for credible businesses with great teams. We look for a company that's really addressing a significant pain point within the NHS and care. And we also look for companies that we feel will benefit from our programme. Companies successful in gaining a place on the programme usually have a product or service that has already been piloted within the healthcare system and is ready to scale. Throughout the 12 months, the programme focuses on engagement with different elements of the health and care system. So as you are, I'm sure, aware, we're now open for applications as of Monday for our 6th cohort, which will commence in January 2022. We're looking for the next generation of digital health innovations that can support our healthcare system to recover and help patients to better self-manage their own health. Today, we're going to be discussing the programme, as I've said, to help you decide if the Accelerator is right for you and your company. And if it is, we really encourage you to, of course, apply. We're going to be hearing, as I've said, from 3 SMEs who are either currently on the Accelerator programme or are alumni of the programme, as well as one of our NHS Navigators. And as I said, the Navigator role is a key role within our team. We do have time for questions after we've heard from our panel, so please do feel free to post questions in the chat function and to ask questions at the end, and we will get to those later. I am now going to introduce our first speaker, which is Dominique from Feebris. Welcome. Thanks, Dom. She's going to talk a bit about what her experience has been on the Accelerator programme, the impact of the Accelerator on their business. And really, we think it's most helpful for you to hear from SMEs that have gone through the programme and from different team members. So over to you, Dom. Thank you very much.
Brilliant. Thanks, Jenny. So I'm Dominique Airy, Partnerships Director here at Feebris. I oversee our commercial strategy, brand and evidence generation. A very, very brief background to Feebris before we get into all the important stuff around the sort of impact of the Accelerator and some of our advice to you SMEs applying. Feebris is a mobile-based software platform powered by AI, which helps users, both clinical and non-clinical, detect and triage deterioration. Our agenda is to enable more proactive healthcare and to do this in a community setting, so powering out of hospital care and communicating this effectively to other teams in the healthcare system. Our technology is designed to act as an early warning system and really shifting risk away from hospital facilities and indeed primary care as well, making earlier interventions possible. Our sort of technical points of difference are very much in the AI and now allowing us to capture really high quality measurements and quality assuring those measurements. And in our focus on workforce enablement and driving really high levels of adoption. For both of those reasons, we have generated really industry-leading returns on investment with our most recent health economic evaluation generating a 9 times ROI across health and social care. We're currently delivering across a range of settings, including care homes, live-in care, domiciliary care, and more recently, district nursing and intermediate step-down care. So enough about us and on to the programme and our experience of the programme. I think for us, this came at really the kind of right time for Feebris. And as you heard from Jenny, I think that was a kind of a material part of A, us being accepted onto the programme, but B, why we've got realised so many benefits from the programme. I think for me, I probably categorise our sort of benefits into 3 sections. First was sort of technical skills that we developed through the programme. For me, particularly leading it from Feebris' side, the work that we did and the support that we've had in terms of developing our value proposition, some of the workshops we've joined, some of the one-to-one sessions we've had in this area have genuinely been game-changing for the business. We've got much clearer on not what we think our value proposition is, for what our value proposition is that resonates with our customers in the NHS and indeed in the private sector as well. And we've really worked with various stakeholders via the Accelerator to refine that. And ultimately that has, the proof is in the pudding, that has really materialized in us having a much clearer value prop and a much more effective commercial strategy. And the ultimate acid test is our revenue. We've gone from having one very small contract to 4 major contracts and a really, really robust growing pipeline. And my view, kind of leading our commercial strategy, is that has really been driven by our understanding of that value prop and some of the work we've done through the Accelerator. The other 2 areas of impact have very much been around one, in terms of peer learning. We've really benefited from some really excellent facilitated peer learning sessions. We've really learned a lot around effective strategies for hiring, thinking about our kind of end-to-end evidence strategy, and a few other areas as well. So I definitely wouldn't underplay the value of what you learn from all the other amazing people on this program. And I think the third area, as you might imagine, for us has been networks. The Accelerator has facilitated some really influential connections for us, both at a national level into NHSX, which has really helped us influence some kind of national thinking, policy development and program development, but also into a range of other thinkers that have shaped our strategy and thinking. The brokerage into the CEO and some of the team at MedCity has also been really powerful for our evidence strategy and value proposition as well. So I think those are probably the three big areas that we benefited from: some key transferable technical skills, sort of peer learning, and some tangible and influential networks across kind of the sort of health tech sector. My kind of advice, kind of wrapping up now, would be try not to focus on what you perceive to be as sort of saying the right thing, as we often do when we're putting in applications for grants processes or otherwise. Really focus on the introspection of what it is your business needs to grow. That in and of itself is a useful process for you as applicants, but that will be the thing that will help set the foundation for a clarity of whether this Accelerator can help you or not, or whether this is the right stage or not. Really think about what it is that you think will accelerate your business now, whether it is refining your value prop, reframing your evidence, or defining a much clearer evidence strategy, or building those commercial networks. But start from your business and work out, rather than thinking about how do I align and make this sound like or align with what I think the Accelerator wants or needs. I think that deep introspection around where your growth will come from and your understanding of that as a business will stand you in really good stead through this process, and if successful, will be the foundation of some of the big buckets of work you'll be driving over the next year. So I think suffice to say, our experience has genuinely been transformational. Our time on this Accelerator has taken us from fledgling kind of startup. We had some evidence and proof of concept. We'd run a pilot. We had an early contract, and we've gone from that to a business that is growing at pace. We're just about to close our Series A. The team is about to triple in terms of its size. Our revenue has done the same. So this has been genuinely transformational. But like any good thing, you really only get out of it what you put in. So I also wouldn't underscore the energy and time required to make this transformational for your business. But I think if you are kind of willing and resourced to do that, I know the others will attest. This genuinely is a transformational process for SMEs. I'm going to finish up there, but thanks everyone, and thanks Jenny.
Thanks, Dom. That was super helpful. I always find it really interesting to listen to different experiences. And I think your point about the value proposition is actually, it sounds like it's something quite simple, and a lot of companies probably think, and I know they do, think that's already all sorted, but actually spending time really breaking that down and seeing it from the perspective of the customer, in this case, particularly the NHS and care system in the UK, is just so important and really kind of crucial to really everything that you do. So great to hear you say that, and I'm so glad that that's been helpful for you. Right, I'm going to now hand over to Brett, who is one of our newest NHS navigators, and I'll let him introduce himself, say a bit about his background and what his role involves. Thank you, Brett.
Brilliant. Thanks so much, Jenny, and thanks for having me. So I'm going to talk a little bit about what an NHS Navigator on the Accelerator program actually does, and a bit about me and just why I became an NHS Navigator. So as a bit of background, I actually studied nursing in Western Australia. I later found myself working as a nurse in A&E for a couple of years, studied a master's in public health, and then became a refugee health nurse, which I did for another couple of years after that. I then moved to London and got straight into project management. I started working with the Sussex Clinical Commissioning Groups, and I then started working on in digital on the Digital First program in digitising primary care across the Sussex region. So I project managed a few different projects, including rolling out remote consultation technology for GP practices, and also working with care homes to help digitise some of their service, especially during the beginning of COVID. And I also did some pathway redesign work for the continuing healthcare service, just in digitising their clinical pathways. So the reason I actually became an NHS Navigator was because I could see from a clinical perspective how new health technology could has a potential to improve the lives of patients, but also how this new technology can make our jobs as nurses, doctors, or AHPs so much easier. But I also, as a commissioner, I could see how challenging it can be for digital health companies trying to enter the NHS market, just because of the complicated regulatory hoops that SMEs are really expected to jump through. And given the knowledge that I've gained in the NHS over the years, I thought the Navigator role was just an incredible opportunity just to work with some SMEs, but also to work on the forefront of new digital innovations, which I find really, really exciting. So just a bit about the role of the NHS Navigator. So a quite unique characteristic of the DigitalHealth.London Accelerator program is that the SME is actually allocated their very own personal NHS Navigator, and each Navigator works with about 5 or 6 SMEs, and their role is to be a dedicated point of contact and a champion for that company. So all the navigators on our team come to the Accelerator with a different variety of clinical or NHS management backgrounds. Their NHS and social care knowledge and experience make them just really well placed to understand the health and care priorities, all the rules and regulations that surrounds it, and how they all work, essentially. And in addition to that, we can also utilize the knowledge and experience of the wider Accelerator team and our healthcare and industry partners as well to support that work that we're doing with our SMEs. So if you're wondering a little bit about what that Navigator SME relationship looks like, I have a few points on that as well, just to give you an idea of what that looks like in the on the program. So critical to the success of the Navigator role is just getting to know the company in depth, especially from the perspective of the team, but also on how the business works. So if we have this really deep and close relationship, we're in the best position to understand and support, and the opportunities that companies need to advance this for an adoption into health and care services. So another point is that we also, as navigators, organize regular touch points between the navigator and the SME. And those touch points are designed to just maintain activity momentum and just ensure that engagement is really focused. They may be weekly or monthly, and that really depends on the frequency determined by that relationship between the navigator and SME. So another point is that positive and effective Navigator SME working actually comes from when companies use their NHS navigators, like myself, as sounding boards, asking us for advice or trusting us to make contacts across their clinical networks to support them in some of their strategic objectives. And as a navigator, we also provide really bespoke support and guidance to our SMEs. So this is kind of supported and directed by quarterly meetings that we organize with our SMEs to set objectives. And that just helps us to identify areas of development need for the subsequent 3 months, and just to better understand how we as a program just can best support the SME. And the final point as well is the navigator's role is also an honest brokering position. So with the NHS and the social care sector, which just gives us valuable insight into the strategic direction of health and social care. And this kind of puts us in a really good position to be able to advise companies on how to navigate it as well. So we have a role of both supporting the NHS and social care system, but also the SMEs on the Accelerator program. And those are a couple of really important points on what that Navigator SME sort of looks like. But I'm also here to answer any questions towards the end of the session. So please pop your questions in the chat, and happy to ask away later on. But that's my bit. I think I'll hand over to Jenny to introduce the next speaker.
Great, thanks so much, Brett. I think that gave a good sense of what the role involved. And just to build on that, just to give a few more bits and pieces of information to all the people listening is, you know, a navigator is, what's great about it, as Brett said, is it is it's the bespoke part of the program. So we have our events which are open to the whole cohort. But the companies that get the most out of the program, as Dom said, are the ones obviously that put the most into it and really think about how best to work with their navigator. You know, it might be you want your navigator to join a meeting that you have with someone within an NHS organization, or to get feedback for you from, you know, even why you weren't successful for a pilot or a contract. It's to help you to learn and to be that sort of honest broker between yourselves and the health and care system. Some companies have come up with really creative ideas, have asked navigators to help them set up round tables, workshops, etc. So there's a lot of creativity that can be drawn upon to really think about how to best work with your navigator. So thanks very much for that, Brett. I'm now going to hand over to Sean from Sweatcoin, Sweatcoin is one of our alumni companies, and Sean's going to talk again a bit about the experience of being on the Accelerator program, but also we'll touch briefly on what it's like to be an alumni of the program. Thanks very much, Sean.
Great, thank you for that introduction, Jenny. Yeah, I'm Sean from Sweatcoin, and I'm responsible for all of our strategy, operations and public sector partnerships at the business. So I think I have about 5 minutes, so I'll try and keep it quite informal and brief and start with an overview of Sweatcoin. So we're a consumer-facing mobile app who developed a platform that effectively incentivizes users to be more physically active by incentivizing you to do that. So as an example, we track your steps and reward you with points that we call Sweatcoins. You can then spend those on products, goods and services in our marketplace. So we're slightly unique in that we spent the first few years of our life focusing on building a user base, so consumer facing. We then, approximately at the start of 2019, decided that it was time to now focus on creating a product for the NHS, and that was my responsibility. So the first port of call was to apply to the Accelerator, and it was probably one of the best decisions we could have made for that new product line we're creating. So we joined the Accelerator program, and as Dominique and Jenny have mentioned, there's a few main benefits that we got. First of those is obviously the networks and networking with not only other members of the program, but also senior decision makers across the NHS. Proved to be incredibly valuable. The second thing was the events that the Accelerator set up to navigate complex topics. And the third was our navigator. So the role that Brett just introduced. Our navigator was a guy called Tom, who was super valuable. And actually we started inviting him to our tender workshops. We invited him to meetings with potential clients and lots of other things like that. One of the most, I guess, productive elements of the program itself was a partnership we formed. So the Accelerator had a launch event to kick off the whole program, and is actually as part of that launch event, we were introduced to an NHS team. And as a result of that introduction, we actually created our product to sell to the NHS. And again, our navigator was part of that. Effectively created a product to sell to the NHS that incentivizes pre-diabetic patients to become more physically active and actually avoid becoming diabetic. And that all basically came about through the Accelerator, through the help of our navigator, and through the help of the wider Accelerator DigitalHealth.London team. That was all an incredible partnership that still exists today. And actually our first pilot that we launched during the Accelerator has now spread, and we've just submitted a bid for over 50 more pilots to be launched. So an incredible result. Now we're an alumni of the program. We still continue to receive some pretty incredible support. So the team have set up a Slack channel where we can literally post questions as we wish. And we also have continued support from the navigators. So I'm actually always on WhatsApp to Tom, who was our navigator, asking questions, getting support. I probably bug him quite a bit, but it's just an incredible resource to have, and particularly for someone like myself who didn't have a healthcare background. The third thing that we've also had support with is our comms. So shaping how we frame things and how we talk about things in terms of our own communications, but also DigitalHealth.London and the Accelerator program have been supporting us in getting more coverage of our work with the NHS, which, as you can imagine, has resulted in further bits of work and further project wins for ourselves. So all in all, it's been a game-changing experience for us. It helped us get a foothold into the NHS and then subsequently expand the commercial relationships we've had within the NHS. So yeah, I think I'll wrap up there and back over to you, Jenny.
Thanks so much, Sean. That was really helpful and great to hear about the strength of your relationship with Tom, your navigator. I think that's so true, just seeing that, you know, often just real deep friendships form actually, and then it's you know, a relationship that goes on, and navigators just, you know, want to help and are really you know, excited to be part of the future success of the businesses that they've worked with. So that's really, really great to hear. And I think you also touched on a really relevant point about how, you know, there's lots of questions in the chat about kind of what stage, you know, do you need to have a pilot, etc., which we will go through in more detail after Adam has spoken. But I think it's what we do see is actually how much also happens after the accelerator. So it feels like 12 months is a really long program compared to your average accelerator, but what we do see is a lot of the groundwork that gets laid over that year. Much of it can also come to fruition afterwards, and that's great to hear that that's happened for you and Sweatcoin. So I'd now like to introduce Adam from Phlo. Adam has actually been part of two of the programs that we run at DigitalHealth.London, our Launchpad and our Accelerator program, and we thought it would be really helpful to invite Adam to talk about the difference between the two programs, because for those of you that aren't familiar with our Launchpad, that is a program that we've been running. We've run 3 cohorts, and we will also be advertising for that program in the next couple of months. So it's one to know about and to hopefully hear more about from Adam and understand some of the differences. So thanks, Adam. Over to you.
Hi everyone, and thank you to Jenny and the team for the invite. Yeah, my name is Adam Hunter. I'm the Chief Commercial Officer at Phlo Digital Pharmacy. I'll give a brief overview of Phlo in a nutshell. We're the UK's first online pharmacy providing an on-demand same-day delivery service of both repeat and acute prescriptions across Birmingham and London. In short, we empower our patients to easily manage, order and track their medications from our pharmacy to their door, and our average delivery time is within 2 hours. So usually in online pharmacy, it's a mail order type service. We've taken more of a Deliveroo style approach where we have our own pharmacies in the cities we want to operate in, and we deliver medication in an on-demand basis. So that's a very brief overview of Phlo. In terms of the Accelerator program and the Launchpad, as Jenny said, we actually went through both programs. We launched Phlo at the end of 2019, and before then we applied actually for the Accelerator program for probably the same cohort that Sean was on. We were unsuccessful in that initial application because we weren't quite there yet in terms of having an MVP product. We were still waiting on the NHS sign off for our pharmacy contracts. So we probably just weren't quite ready to really get the full benefit of being on the Accelerator program. It was then suggested at the time that maybe we wanted to look at the Launchpad program, which was maybe for companies that were not quite there yet for the Accelerator, but there was some promise within what we were looking to do. So the Launchpad program was really important for us because that was coincided with the lead up to actually launching Phlo back in October 2019. So it gave us a good overview or an understanding of the NHS ecosystem. And that was particularly important for us because you might have guessed from my accent that not from England. Phlo is headquartered in Scotland, but all of our pharmacies operate in England. NHS England and NHS Scotland are two very different organisations. So I would say that one of our weaknesses was that we didn't have a good grasp on the English NHS ecosystem, and understanding that from a pharmacy perspective was really important. And the Launchpad really tested a lot of our assumptions before we ended up launching Phlo back in late 2019. So for me, the Launchpad was really good. It was not as intense as the Accelerator, but it tested your assumptions. It tested your business model. You got the opportunity to meet different people within the NHS ecosystem, which I particularly found very useful. And much like Sean, I don't come from a healthcare background, so just getting my head around the various acronyms that get used in in healthcare, that alone was worth its weight in gold. After the Launchpad, we got Phlo up and running, and that was successful. COVID then happened, which was as no one was planning for that. And then obviously we thought, actually, you know what, the Accelerator program can help us get what was an initial idea to the next level. And really for us, what we've got out of the Accelerator, which I think is probably slightly different for Phlo, is because the way that pharmacy works is you don't have direct relationships with NHS trusts and GP practices and hospitals. It's very regulated, you know, it's all patient-led choice. So whilst, you know, Feebris might have direct contracts with an NHS hospital, we would only deal with patients directly. So we're very much a direct-to-consumer business. But what it did give us, though, was an understanding of the wider challenges facing the NHS, where the digital ecosystem was going, and how Phlo might be able to fit into that to help with their move to a more digital-first agenda. And also for us, an understanding of that wider ecosystem and establishing our credibility. Unfortunately, there are a lot of cowboys in the online pharmacy space, and it's important for us that we wanted to set the standards of what should be expected from an online pharmacy. And by working with Digital Health London, speaking to so many different people in the ecosystem, whether that's primary or secondary care, has helped us achieve that. I think as well, also for us, something that we've really benefited from, although I'm the main point of contact for the Accelerator program, I've tried to make sure that as many people on our team can get involved in the Accelerator where appropriate. So our pharmacists, our designers, our product owners, our marketing team, our engineers, our data engineers, really to embed them within the Accelerator program, because that is really added a lot of value to their ongoing professional development, to really understand what opportunities and how the NHS works. It's really helped with our NHS login applications, our IM1, which is an integration tool with GP practices. All of that type of information and training sessions that have been available have been a really useful tool. In terms of applying, I would highly recommend you apply. I would say apply to the Accelerator program. If you're not successful in that, then you can also apply to the Launchpad program. I don't think it's necessarily if you don't get in the first time, you know, you can try again. But the key for me was that we didn't give up after not getting into the first round of the Accelerator program. And actually, on reflection, I'm glad we didn't go straight into the Accelerator program, because I don't think we were quite ready as a business to get the most out of it. So doing the Launchpad was actually a blessing in disguise for us when we did it. Advice in terms of applying, be really specific about, you know, why you're applying for it. Really talk about it internally within the business. What are you looking to achieve? And really try to understand how Digital Health London can help you. Take the time to really understand the application process. It can take a while, so don't leave it to the last minute. Would be one piece of advice. Do the video pitch. I know that's optional. I don't know if it may be compulsory from now on, but certainly the video pitch helps you do that. But it also helps you challenge you and understand what you're exactly offering and what is the pain point that you're trying to solve, and being really clear about that. And that pain point might change. You know, when we applied to Accelerator, our pain point was, you know, avoiding people not wanting to go to queues and stock shortages in bricks and mortar pharmacies. But then COVID happened and the pain point completely changed. It was about, actually, can we get people's medication when they're isolating and everything else? So the pain points that you can address along the way will change. So you've got to be open and flexible to that. And if you do get on the program, I would also suggest you've got to commit to the program, because you will get out of it what you put in. If you're a bit kind of half in, half out, you will get the half in, half out results. But if you're fully involved in it and really develop those relationships with your navigators and the other people on your cohort, then you will get a lot out of the program.
Great, thanks so much, Adam. And I would, definitely reiterate that, particularly the part about involving other people in the company, because there, you might have a new starter that would really benefit from one of our events, but perhaps the point of contact or the founder, already has all of that knowledge. And so it's a really useful way to kind of train up the rest of your team and get everyone on the same page. So thank you very much, Adam. Okay, so I'm just going to wrap up just with a few points now, and then we'll move on to the questions. It's great to see that there are lots of questions in the chat. Just 1 second. So just to go through some of the dates again. So applications open, they opened on Monday. They'll close on September the 12th. So please do apply if you feel that you are tackling a real problem within health and care. And as Adam said, you really know what your pain point is that you're addressing. Of course, we will help you with that, but it's good and important for you to be very clear about that. The session has been recorded, so if you want to listen to it again or you want to share it with other people in your team, please do so. We're going to be sharing this across our channels, so you can watch it back. I also would really encourage you to take a look at our website. We've got a really comprehensive set of frequently asked questions, which includes everything from what the eligibility criteria are to what, as I said at the beginning, what we look for. So how do we select companies? What the program itself is, how it's delivered. So how much of it is face-to-face, how much of it is virtual. We have done our best to really think about all the questions that people might have. And it's a live FAQ for us, so we're always adding to it. So we do welcome any additional questions that you feel are not answered there. So thanks so much again for joining us. We will move on to questions now. What I'm going to do is start with the chat, but whilst I do that, I would really encourage you to add any other questions. Please, no question is stupid. It's helpful, and it will have, I'm sure, been asked in the past. So please do add in your questions. So the first question I'm going to read out is, do you need to have completed your pilot prior to application or just prior to January 2022 to qualify? I think this is a kind of a grey point, in that most companies will have a pilot, but not all of them. And there are different ways that we support different companies. We do have a real bespoke element, as I said. So it might be that you haven't yet completed a pilot, or in some cases, not many, that you actually haven't even started it yet, but we're so convinced by what you're doing and you've been able to test your business idea so well and get so much feedback from potential users, clinicians, etc., that we feel that there is really something in what you're doing. What I would say though is it's probably more likely that you'll get a spot, and also perhaps, as Adam was saying, you might get more from the accelerator having already done a pilot, because we can then help you to kind of build out from there. So it's kind of like a funnel. The earlier stage you are, the more you might learn technically from our events, but it might be more about your knowledge base, your kind of really getting to grips with your value proposition, and less about us being able to help you to scale. But that, as I said, might come afterwards. So it's not a black and white answer there. So I hope that was helpful. Then there's a question to Dom. Anything you would like to answer that? So I'll read it out. It says, thank you very much. How did your business strategy and product strategy change as a result of the accelerator? So whatever you feel comfortable sharing.
Oh, it's a good question. It's a deep question. I suppose I would start by saying, I think it structurally changed our outlook in the first instance. I think we went from being a product-led company. Our origin actually originally was in academia. Our founder had developed a machine learning tool through her PhD, which had quite a different use case. It was being used to early detect pneumonia in the community, but in low-income context, not in the UK and not in the NHS. So our origin and our kind of DNA was very much AI, very product-led, a different kind of incarnation. And I think when we started delivering work in the UK, we was just too product-led and not market-led enough. And I think being in the accelerator and that constant process of feedback and the kind of constant battering and challenging of our value prop in a really good, helpful, constructive way, I think started to shift our strategy towards where is the product market fit. So it really shifted our kind of structural outlook on how our business was going to work. I think then practically in terms of what that meant kind of commercially and product wise, naturally the value prop shifted. We moved from talking about AI into measurable benefits. We talked far more about accuracy, and we did all of the work that sat behind that made sense. So my evidence publication strategy became about accuracy and how I proved accuracy and vital sign measurement, and that's what I talked about. And we kind of moved away from talking about AI as an end and actually started talking much more about the benefits of AI, which really helped with clinicians and commissioners and all of our stakeholders. You started to get what it meant. I think, like Adam, we started to think a lot more about how do we implement standards around what good looks like. And that's not just talking about AI a lot, it's talking about specific measurable benefits that AI delivers. I think from a product point of view, I think it also shifted us into meeting the market a little bit more where it was. So for us, that kind of manifested in two different ways. One, with some customers, we've pared back what we kind of call Feebris Lite now rather than Feebris, which is not all customers require the same level of intensive sort of change management workforce support, which enabled us to be more kind of price competitive. But so just meeting the market where it was, not what we thought was kind of product-based, product-led. I think the second area has been around co-development, actually. I think we've realized more and more, and our biggest customer now, which we're hoping to be able to announce in the next few weeks, we've really pivoted away from saying, here's a product, and taking much more of a kind of proprietary solution approach to how do we solve your out of hospital issues across the entire trust and lots of different use cases, and how do we co-develop something that works for you? Yes, we're going to start in these use cases where we have a product and we can build up, but actually taking a much more fluid approach to how our technology can be applied. And we're talking about the difference us working with contracts of 50,000 to contracts that are into the millions. And so I think it's really informed strategy outlook, meeting the market where it is, and that's then manifested in how we communicate, actually what we see as our value proposition, and then how we take the product to market, and how we were flexible about the product on the kind of co-development side. So it's both kind of philosophical, but also practical in terms of how that manifests.
Great, thanks so much, Dom. Just underneath that question, there was another question quite similar in terms of what is meant by a completed pilot. I hope that my previous answer has given enough on that. Next question, do you have to have a service that you are selling to the NHS? Are best practice sharing services free to NHS and social care staff and organisations, with our commercial model being sponsorship from NHS suppliers? So the answer is no. You don't have to have a service that you are selling to the NHS. I would say that most do, but we certainly have had companies on the accelerator that don't do that. And it's really about us still giving you quite similar support, because whether or not someone has to pay for something, they still have to adopt it. And in the healthcare system, that can be just as challenging. We have worked with many companies that have got contracts, but they still need to get the actual activity and those adoption rates up. And that is certainly something that we can help with. Can companies that have both a digital health app and a medical device hardware component apply? Again, yes. What I would say is that that kind of company wouldn't be maybe the sort of the typical. We certainly have a number like that on the accelerator at the moment. And what we try really hard to do is cater for everyone. So actually our cohort is really diverse. And sometimes that's challenging for us because the events are for everyone. And so obviously everyone comes at a different level and has different needs. But that's why we've got the Navigator element of the program. That's the bit that's really bespoke. And we are always happy and try to learn from our companies in terms of making sure that bits that maybe aren't as relevant to all of the other companies, we still provide you the support that you might need. So I hope that answers that. I'm currently building a digital health platform. The prototype is ready. How many active users would I need to have before applying? I mean, I think that's quite a difficult question to answer. Partly it depends on who else applies to the accelerator and what other evidence you have. I certainly think that the more users that you have, and having a minimum of, I don't know, say like 30 to 100 is useful, because then we actually know that you're learning. Even if it's a small number, you're still, we might ask you a question in the interview around, well, what feedback have you acted on from your users? So if you've only got 2, that's pretty difficult. The more you've got, the better you will be able to answer our questions, and the clearer you will be on whether your product is going to add value and get adopted. So it's a scale, I would say. Then there's a question about regulations. What are the key regulations that the program helps SMEs with? And I would say, our event program is really comprehensive. And we also organize one-to-ones. We bring in people from a whole host of different backgrounds and areas of expertise. And if it's a requirement that the NHS needs you to have, then it will be part of the program. Or worst case, we will be able to help you find someone that can provide you with the advice that you need. So it's sometimes within the team we have expertise in particular areas, but other times it's about our ability to bring people in, and we do with our events bring in a lot of different individuals and organizations that help us run our events. And sometimes then for companies, if they want more input from particular experts, they go on to have a relationship with those individuals. The next question is the program open to innovations that have real-world validation in social care only currently, but have application for NHS-funded care too? Yeah, absolutely. We definitely do. And I would say that the team, the Accelerator team, has quite an NHS-focused kind of background, but increasingly we have been doing more and more and networking more and more in the social care space. So we do have dedicated events. And one navigator that's particularly interested in that area. But I think with the ICS priorities at the moment, obviously bringing the 2 together, it's really important that if we can see that something has worked in social care, what the benefits could be for the NHS. So yeah, definitely. But the more learning you've done, so the more able you are to explain in your application why you think that's relevant, the better. So then there's some questions about whether an AI medtech startup which has already received the NHSX funding is eligible to apply for the accelerator. Definitely still eligible. I think the key is there is probably picking up on some of the things I said before about the type of company that applies and whether or not you'll be kind of on the edge of kind of what the typical company is. and therefore it might be that not all of our events are, as relevant to you, but there certainly is, as I said, the bespoke element of the program too. The next part of the question is, ours is an Indian startup with a registered entity in the UK and a dedicated team member based in the UK. Are we eligible to apply? So yes, one thing that has been different over the last couple of years in the Accelerator is we have a number of places for international companies. And so we're currently supporting a company based out of Belgium, another out of Germany, and obviously the last year we've been fully virtual, so that's not been a problem. I think it's good to hear that you've got someone in the UK, because I guess what you'll hopefully pick up from our FAQs is that we don't know quite how health and care is going to shift in terms of whether people are going to want face-to-face meetings. I mean, the general default in London at the moment is, not encouraging face-to-face meetings and minimizing, people going into different healthcare settings, but that of course could change. So actually having somebody that is available that can have those conversations. And we will, of course, also have a number, government guidance and COVID numbers willing, a number of face-to-face events. Our current plan is to have 6 mandatory face-to-face events for the Accelerator programme for cohort 6. But, we're also very sensible and, and we don't do things for the sake of doing them. We try and learn from our companies and be as efficient as possible in terms of whether we do things virtually or face-to-face. Brett, a question for you. What are the areas in nursing you prioritise for digital health tool development?
Yeah, good question. And I think it really depends on the nursing specialty, but I think from more of a broader sense, I think a few key areas would be digital tools that help to improve the digital literacy of nurses, or tools that at least are made simple and easy to use for nurses or any healthcare staff that are really simple and user-friendly. I think that's a big key focus at the moment. I think in the context of COVID-19, obviously care is now more and more being delivered at home. So technology, and especially remote patient monitoring technology that improves the accuracy of vital sign measurements taken by patients at home, is becoming more and more important, just because we're looking at because as patients are now more and more cared for in the home, I think it's really important that care is being delivered safely and effectively. So I know Dom at Feebris and the team have been doing a lot of work around making sure those vital sign measurements are taken in a more accurate way. I think probably a third point, which I think is from a general perspective, is automation as well. So automation in terms of automating nursing assessments and automating nursing processes, which are generally quite menial and quite simple. If these can be automated in a way to make our jobs easier, then that would certainly be a big priority at the moment, especially when we're trying to make up for capacity in a lot of the hospitals and trusts. So I don't know, a random example is automating the way that pre-op nurses assess patients before surgery or before a procedure. There's certain criteria that they have to meet, and automating processes like that could just simplify that process a little bit and streamline patients through the system. So a couple of very general areas, but I've messaged that individual as well in the chat, so happy to have a separate conversation too.
Brilliant, thank you, Brett. So the next one is there a date for the Launchpad? The answer is yes. So we haven't actually shared that date yet. We will be shortly. The call will open in October. We're just recruiting at the moment for the Navigator that will be running the Launchpad. So it's slightly tied to that as well, but it will run from November time. Then there's a question about whether it would be most appropriate to apply for the Accelerator based on a product which is an empathetic chatbot designed to scale mental health, self-management and informed diagnosis that's being piloted next year with US Department of Defense. I mean, based on the information you've just provided there, I would say Launchpad could be good. Particularly if you haven't worked in healthcare before and you're not sure quite how that would work. But equally in terms of the problem you're solving, clearly it's a big one. It's a very relevant one at the moment. So I wouldn't necessarily say that it's a complete no for the accelerator. I think would potentially need to know a little bit more. But yeah, so I think my answer would be you could still put in an application. And what I would say is, although it is a reasonably time-consuming process, I do think actually what companies tell us is that it's actually quite useful, because you kind of just think through some, the typical questions that an investor might ask you or a customer. So hopefully in itself, it's not a wasted exercise, even if you're not successful. There is another question about, I think this is about eligibility of a particular type of business. So are there parameters on how long the business has been established for, i.e. over 20 years? No, there are not. But now transitioning into digital delivery, taking that experience and improving results in a non-digital delivery. No, the only thing that's important is whether you qualify as an SME. So that's about the number of employees that you have, no more than 250, and your annual turnover. And there are some questions about that in I think it's pretty much the first part of the application process, and that's all covered in our FAQs. If you are moving customers over to digital, no, I think what would be more important is how big a problem is that, and how important is that for NHS staff. So if that, by moving to over to a digital solution, that's really makes a big difference and really solves a big pain kind of point, then we would be interested. Next question is, do you accept solo founder? And how much scientific health background is required from the founder and or the team? So we don't require a specific amount of scientific or health background. A lot of founders or kind of key points of contact on the Accelerator program, as I think Adam said, do not have a healthcare background. What I would say about solo founders, though, is that we're not a really early stage accelerator. That it might be that the Launchpad is more appropriate, just because of your bandwidth and how much you would be able to really get the most out of the program. It might be that waiting and joining another cohort may be better, and potentially exploring the Launchpad. So I'm trying to think if we have accepted solo founders. If we have, it's been extremely rare, mainly because we do get kind of concerned about how much time you would have to commit to the accelerator, and therefore whether you would get the most out of the program. Would you consider a company that addresses the same workforce issue addressed by a company that was in last year's cohort, even if the value proposition offered is different? So yes, is the answer. We have had, because we support so many companies, so originally the first and second year, our cohorts were really large. We supported up to 30 companies. And so even on the same cohort, we had competitors. And to be honest, in terms, so there would be things that we had to do internally to make sure things like you didn't have the same navigator, that we had some clear kind of lines that were drawn so that information wasn't shared, etc. And we really all agreed kind of how that process would work. But from the point of view of kind of the healthcare system, they actually like it if there's a variety of options, because then they can decide which solution is best for them. And as you've said here, even if the value proposition offered is different, maybe that really matters someone else. So we don't only ever select one company in one space and that's the only company we ever support. Far from it. We're really about building kind of the market and about supporting lots of different solutions, even if there's crossover. And as I'm sure you know yourself, if there are lots of competitors, then it genuinely means that you're onto something there. Next question. Some of the early stage startups with innovation need clinical validations before adoption in the NHS. How do you support in such cases? Brett, do you want to, is that a question that you could answer from a Navigator perspective?
So I think it's a really good question. Certainly, some of the companies that we do support on the Accelerator are more in the earlier stages, and perhaps what they need is they need our connections into the NHS to understand exactly who to speak to understand exactly which clinical pathway they might fit into as well. Sometimes with the scoping work that we do, it involves looking at a clinical pathway that perhaps is very suitable to their particular technology. Other times it may be not so suitable to that particular technology. So I think in answer to your question, yeah, I would say certainly a big part of that is introduction with stakeholders into the NHS and trying to use our network of contacts either through the Health Innovation Network, the organisation that we're part of, or through the wider Accelerator program, just to introduce you to the right clinical people, just to understand, firstly, where does it fit? And then secondly, to get that clinical validation and potentially pilots in the NHS so you can get that validation that you can use for future bids or contracts or anything else like that. So a big part of our role is just, again, that honest brokering system, trying to find where your technology fits and exactly where, which clinical pathway it's best suited to so you can get the validation you need.
Great, yeah, thank you, Brett. Really good answer. It's it's certainly about how we help you get that clinical validation by putting you in front of the right people so that you and a diverse group of people so that you can really get that breadth of feedback. And this year we're really hoping for a really diverse group of companies to apply. So if you do identify as an ethnic minority or particular group, please do consider applying. We think it's really important that the health tech solutions that are out there are really solving a broad range of problems, and having that kind of personal insight into different areas of health, potentially as a patient, but also as a clinician, is really relevant and I think helpful. So check out, as I said, our FAQs for further details. Follow us on Twitter, sign up for the DigitalHealth.London newsletter. That's how you'll find out when our Launchpad call has gone live. And if you do have any further questions, anything you think of overnight, please do email us on the applications DHLA@digitalhealth.london email address. Thanks a lot. Thanks for joining us.